the insurance game is ever changing. It's very hard for one person to stay up to date on all the insurance billing and changes. And that's what my team really brings value to the practice is they'll work with one person with us, but they have the brain power of almost 30 people, which is super powerful.
Hello, everybody, and welcome to another episode of the Raving Patients podcast, sponsored by Dental Intelligence, the Doc Sites, and Cloud Dentistry. Today's episode is called What Do You Mean You're Not Outsourcing Your Insurance Billing? My guest is Angela Holland from Preferred Dental Services. Angela, thank you so much for joining me today.
Thank you for having me. I'm excited to be here.
Why don't you tell people a little bit about yourself, what you do, how you help dentists, a little bit about the company Preferred Dental Services.
Sure. I'm Angela Holland, founder of Preferred Dental Services. I started the company in 2019 because there was a need for an outsource billing company that wasn't huge, provided really a white glove service to these dentists, and I knew that I could fill that void in the industry. I work with some of the top dental insurance billing specialists to take care of our offices. And I actually decided to proceed with starting Preferred Dental Services after the Dental Intel Mastermind Summit. I knew that through meeting all the coaches, whether they be dentists or practice management consultants, there was just such a void in the industry for really accurate and really good customer service from a billing company. And I wanted to be that company. So I started on my kitchen table doing the individual billing for practices nationwide. And when it got to be too many for me to handle on my own, I started bringing in other experienced billing specialists. And from there, we've grown to quite a healthy size small business. And we are functioning really well and love what we do, take pride in what we do.
That's awesome. And just so people know, just give a little bit about your background, where you live, your little family. I know you're pregnant, due in February. So just give a little bit about yourself so they understand more about you.
Sure. I moved to Arizona from Maryland in 2014, and I started with doing software sales to dental practices, actually. And from there, I decided that I really loved the business aspect of dental practices. So I decided to go in and work at a practice doing insurance verification and then to billing and then eventually office management here in Arizona. And the wonderful thing, not only did I find what I love to do, but I also met my husband out in Arizona. We have one daughter who's 16 months old and another daughter on the way due in February. So we are constantly busy, but it's wonderful busy.
That's perfect. So let's get into the content that we wanted to talk about. And I want to start off with, as many know, my practice, when I owned the practice, the Pennsylvania Center for Dental Excellence, was a fee-for-service practice. It still is. I just don't own the practice anymore. And when this episode goes live, I will no longer be in the office at all working. As of basically December of this past year, 2022, I will cease doing clinical dentistry. So, but we were a fee-for-service practice. So I'm curious, one of the questions I want to ask later on is how do you, what type of business works best for you, whether it's PPO, fee-for-service? We still build the insurance companies, but we'll get to that. So the first thing I want to ask you, though, was what are the three most common billing mistakes offices are making right now?
That's a great question. So what we see on a daily basis, especially when we're onboarding new clients, is there's a couple things. One is the insurance verification is not accurate. So the office is not proceeding with care in the best way possible to utilize patient benefits. I don't believe that insurance should dictate the treatment that a patient is getting. When a doctor prescribes treatment, it's necessary. But I do think that operating in a way where the office knows exactly what they should be getting reimbursed is a huge value to treating patients. The other piece of insurance verification that is very effective in practices that we're not seeing done is knowing if the patient is maxed out so that then the practice can collect 100% up front. Or if the patient has frequency on a crown that they're needing to complete, if it's going to be denied, collect 100% up front. practices are much more successful at collecting on the front end than, as we know, chasing them down to get paid on the back end. Another issue that we're seeing mistakes being done is blind or fraudulent activity. In most cases, it's blind fraud. You know, these practice billers were not aware of the fraud that they were committing. They were simply trying to do their best job. But for example, we went into a practice 2 weeks ago, and we noticed that the office is submitting their X-rays and prophy and new patient exam on one data service, and the following day they are billing out another set of X-rays. That's a huge no-no. That is absolutely insurance fraud, and we had to educate the office on this and explain to them how we can pivot, and so that they wouldn't be losing reimbursement. We know that the dentists are working so hard that a lot of times they aren't even aware of what's going on in the front office as far as billing. This doctor specifically was mortified of this issue happening. He had no idea.
So I have a quick question for you based on that. So that I know happens more often than not. So can you talk about specifically to that point why one it's insurance fraud, but two, how do you get around that? How do you mention pivoting? How do you pivot? Because I'm assuming what they're doing is they're submitting a pan and bite wings, or that's what they're normally doing. If they don't have coverage for an FMX, or they're submitting bite wings instead of a full set of X-rays. So just talk about specifically that one thing right now.
Sure. So finding out ahead of time what the patient is due for based on frequency for their X-rays is going to be a great way to bill based on their insurance and to take X-rays. Of course, if the doctor needs a panel for that first appointment, or if the doctor's needing additional X-rays, of course, you have to take the X-rays. But be willing to understand that the downgrade on that X-ray is not a bad thing. It's a little bit less money, but the payoff is so much better than what could happen with being caught on an insurance fraud audit. The other thing is, it takes one patient saying, I didn't receive this X-ray, or I didn't come in on this date of service, I came in on the day prior. It takes one patient to call, or one disgruntled former employee to call insurance and create a huge audit. And I've seen both be done. So the biggest thing is to understand the patient's insurance. And then the other thing is to not be scared of the downgrade. It is what it is, but the payoff will come 10 times over.
Gotcha. So I interrupted you when you were talking about the three most common mistakes. So I apologize. You can go back on that.
The other one is basically due to lack of time or lack of knowledge of the timely filing with insurance companies, is that the office will send out the claims. They'll send what they think needs to go, but then we'll come in and there will be hundreds of claims that are not getting paid due to needing additional information or simply needing to be appealed. They've been denied. They just need an appeal. Because the office doesn't have the time to follow up on all that. And so it's not a matter of they're doing it wrong on purpose. They just simply, there's not enough hours in the day to juggle their patient care, scheduling, keeping the schedule full, and the insurance aspect. So I would say the third one is just due to lack of time. So the consistency and follow-up is not where it should be.
Gotcha. Great. So let's talk about the advantages of using somebody for outsourcing. I mean, that's what you are. You're a remote service. You're helping the practice. Are you, and I know there's a number of different companies out there. So specifically for your company, do you, after the patient are checked out, and your bill, they set the appointment complete, you're coming in at the end of the day, you're submitting the insurance claim to the insurance company. You're following up with them if there's any denials or narratives needed. And then are you also billing the patient afterwards, or any remaining balance that remains, if whatever copay, if they didn't pay enough, or they owe more after they balance bill the patient? Are you doing all of those things?
Yes, we offer both of those services. So our main source of service is the insurance revenue cycle. So we handle the claim submission with proper narrative and attachment, posting insurance payment, and working the insurance AR. As an additional service, we do provide patient billing, but it really depends on the practice and demographic and setup, because we have some offices that work with our patient billing where we will handle the billing for them and it's very successful. But other practices may be more of the small town feel, we really like to leave it up to the office to do the patient billing because there could have been some sort of agreement discussed in office that we don't know about. And we always want to make sure the patients are having the best experience. And if they're not expecting a statement, we don't want to be the ones to send it.
Gotcha. Okay. All right. So going back to where my question was going to go, obviously you're a remote service, you help practices. How do you actually feel you help the practice versus handling it internally? Because obviously there's large employee problems right now. You can replace a whole employee basically for what you're doing. So how can outsourcing help a practice?
Yes, aside from the staffing issues we're seeing, I think nationwide in every single industry, we help the practice. So in 100% of offices that we work with, we lower the insurance AR, so the outstanding money, and we increase insurance collections. And I wish I had some glamorous answer for you, but it really does boil down to that we are committing 100% of our time to the insurance and insurance aspect, getting those claims paid. And it's simply put, where the energy goes, the money will flow. That's how we operate. That being said, my team, we have, monthly meetings. So we're all up to date on all the updated codes, possibilities of how we can build differently and more strategically to increase insurance revenue. So we're always up to date with the latest and greatest to make sure that we are operating, at all speeds for the practices. So it's a much more team approach than just having one gal in your office who all she does is billing, but she's not able to, communicate with other billing specialists who are seeing the same issues and able to pivot those for the solution to get paid.
Now, the other service that practices are interested in are insurance verification. Do you handle that as a service as well, or do you just focus on the billing side of things, that part?
I love that you asked this because I get asked every single day. Every single day of the week, I'm asked this question. We do not currently offer insurance verification services. That being said, when we are able to take the insurance revenue cycle off the office's plate, it usually allows practices some time to be able to focus on that insurance verification piece that is so, so important to the success of the practice.
It's interesting to me because, like I said, I had a company that we hired towards the end of my reign as owner that was doing insurance verification for us. We never had it. And then I actually hired they hired an insurance billing company as well, but there isn't a company that does both. And you would think that comes hand in hand. They verify insurance, they handle the billing of it, they talk to the insurance companies. You think that would be all within one realm. And I guess it really doesn't exist that much.
It's really hard from my experience, only my experience, it's really hard to find people that are able to do insurance verification, that live in the United States, that are able to work on all softwares, because that's the other thing is you're not just getting one or two practice management softwares, you're getting 8 to 10, and to be able to do it effectively and efficiently and be able to be compensated fairly. So I haven't found the solution to be able to compensate my team that would be doing the verifications. And for me, it's super important, first and foremost, that I take care of our clients, but also that I'm taking care of my billing specialists. So until I find the right compensation to not be overcharging an office and underpaying staff or vice versa, that's just not going to be in our solution for the time being. But I know there is a solution. I just haven't found it.
Gotcha. Okay, that makes sense. So talk a little bit more about the insurance revenue cycle run, how it works, what a practice, if they want to do it on their own, how do they get better at doing it versus, again, going to a company to do it remotely for them?
Sure. So the insurance revenue cycle would include claim submission, insurance money posting and adjustments, and then working insurance AR. So what someone can do to do it successfully is, one, it has to be their full-time job. For most depending on the size, but most offices, it has to be their full-time job. And on a daily basis. So you cannot wait a week or two to submit claims. You must get that claim out within 24 hours of services being rendered. If you're waiting additional time to submit claims, the cycle of the money coming in is going to be much slower. So on an average, with all the insurance slowdown that we're currently seeing just due to short staffing on the insurance end and stuff, claims are taking about 30 to 35 days on average to pay. We go into offices that they're taking 45 to 65 days to pay. And what that first tells us is that they're holding claims, so they're not submitting them right away, or they're not submitting the claims the first time with the correct information. So you have to make sure that when you submit the claim the first time, that you are including all documentation necessary to get paid. So for claims, that would be a narrative on some, perio charting, and x-rays. And then the x-rays are specific to the treatment being done. And we always recommend having a set of narratives that work, that you're basically, it's a narrative of a narrative. So you're filling in the blanks for those narratives based on the actual diagnostic notes that the doctor is placing in the chart. So every claim that goes out must be personalized to the patient, but it's included basically with keywords. There's keywords that the insurance systems will automatically pass through. Okay, approved, approved, approved. It includes X, Y, and Z. So having some templates of the narratives will help you be most successful in the long haul. Another thing is posting payment. As you're posting payment, if there's something that should have been paid that's getting denied, appeal it right then, appeal it. Don't let additional information or appeals go weeks out. Do it right then and there as you're posting the payment. And then the third thing with AR is a lot of third-party billing companies will follow up within 30 days. So my team is responsible to follow up on AR every 7 days, so once a week. And the way we do that is we have an AR day that they set aside where that's all they're doing. They're working AR for the office. So on a weekly basis, those claims are going to continue to get paid. And that's what works for us. So we would encourage any practices that aren't outsourcing, but have someone in the office able to do it to really work in that manner as well.
You mentioned a narrative and templates for narratives almost. So narrative and narrative. So I was, one of the most interesting ones is when you have cracked tooth syndrome. So I created a narrative that is very much the same for everybody with a cracked tooth syndrome. Patient presents with pain on biting, confirmed pain on biting, transilluminator reveals cracked tooth, prepared tooth for a crown. Tooth may still need endodontics in the future. Please pay according to plan benefits. So it was the same thing no matter what the diagnosis was, because we knew what was needed to be said within the documentation that we provided. And very infrequently do we find someone say the claim is denied because we were using the proper verbiage in the narrative.
Totally. Yes, it's so valuable. And when the doctors are able to have the templates for the billing specialist, it makes it that much easier to get the claim paid, because there's two things that insurances are now requesting that maybe even a year ago they weren't. One is screenshots of the exact diagnostics. So when the doctor's making those templates and adding them in, perfect. We can screenshot it, we fill in the blanks, and we make it known. And then that note within the patient's chart supports that information. The other thing is they're asking for cracked tooth diagnostics. How many millimeters is the cracked tooth? That's a new thing that they're asking that we're trying to stay on top of, making sure that our doctors will provide approximately, 1 millimeter, 2 millimeter cracked tooth.
And I would assume the same thing for scaling and root planing, because the definition of scaling and root planing, which is probably one of the toughest things that you hear about, is there has to be attachment loss. There has to be radiographic evidence of calculus. There was a post today in one of the Facebook groups that there was so much calculus, and they showed a picture of the teeth, and it was still denied. So I always laugh when I hear these people struggling to get approvals on things. I've never had things denied because I give them the proper evidence that the work needs to be done.
Absolutely. And some of our offices, it's as simple as calibrating your hygienist on what proper bone loss looks like. Not that they are uneducated in knowing that, but to know what exactly the insurance companies are looking for to make sure that we are able to get that claim paid. So if the x-ray is not showing adequate bone loss, the perio chart and narrative could be on point, but insurance could still deny that based on the x-ray, the SRP.
And they may also downgrade to 1 to 3 teeth instead of a full quadrant, depending on what the information you provide them shows.
Yes. So with the practices that we work with, we'll help to educate them on proper narrative, what exactly diagnostic notes we're needing. And again, diagnostic x-rays, hey, for crowns and buildups, having intraorals now, oh my gosh, it's so valuable. And it's not a matter of us not being able to get the claim paid, but it's getting it paid faster than having to appeal it and go back and forth,
100% so. So let's talk about from the patient's perspective. Why do you think patients appreciate accurate insurance billing?
So I heard this saying many, many years ago, and it has stuck with me, that the paid up patient is the happy patient. And I can only relate that to my personal experience. When I go in to see my medical doctor or my dentist, when they present fees to me, I know it's an estimate, but when I pay up front and then I'm not expecting to get an additional bill from the office, then I get the bill in the mail and I'm disappointed, but I'll pay it. But that being said, there's some patients out there that when they receive the bill in the mail, they start avoiding the person that's billing them. So we never want someone to avoid going to the dentist simply because they owe money that they weren't expecting to owe, or simply because their insurance didn't cover something because the verification wasn't on point. So truly, truly, the paid up patient is the happy patient, and they will continue sending referrals and future treatment because they feel that there's been some sort of trust and value created between them and the office. And I think that when you create that relationship, that's a very happy long-term patient, and they'll send many people your way.
I agree with that 100%. So what trends, I mean, insurance is ever changing. There's so many things in the insurance industry. Every day you see posts on the internet regarding it. What trends are you seeing in the dental insurance industry? And how can you help offices pivot when it comes to these changes that are taking place?
Yes. So I have mentioned a couple just in our conversation thus far, but one thing is making sure that the doctor's notes and hygienist notes are matching what we're billing. So we provide narrative templates to the office so that we can then have them fill in the blanks for things, because the insurance is now requesting the screenshots. So we want to make sure that everything is aligned to get you paid the first time. The other piece that we're seeing a lot is requests for intraoral photos or denying a claim due to lack of evidence. But yet, if we provide the intraoral photo, they'll pay the claim. And I know it's an additional expense to the office, but every single practice would benefit from having intraoral photo cameras. It will pay for itself and then some. Because taking pictures of prepping the tooth and getting the tooth ready for a crown, root canal, things like that, it's really going to help show evidence as to why that treatment was needed. And it will make the billing specialist have a much easier time proving this is why they needed treatment and here's the evidence.
Gotcha. Perfect. So any other specific points you would like to make regarding the insurance billing, all these other aspects that we talked about that you think are really important to let the listeners know about?
So I think the biggest thing that people should be aware of is that there's no proper training and education for insurance billing. There's a couple courses and seminars, but what I've found is that they're outdated because the product or the course was created many years ago, and the insurance game is ever changing. So even when you have someone come in that says they know what they're doing, they're up to date, I think that they mean that wholeheartedly, but with the way that insurance continuously changes, it's very hard for one person to stay up to date on all the insurance billing and changes. And that's what my team really brings value to the practice is we have, 20 billing specialists plus working together on a daily basis to make sure that if they can't get your claim paid, that they'll ask the team so that then they have all the other resources and knowledge of everyone to get the claim paid. So they'll work with one person with us, but they have the brain power of almost 30 people, which is super powerful.
Gotcha. Perfect. All right. So let's switch gears here. Let's use a few minutes to go over these pod deck questions. And for those that are listening to the podcast for the first time, these are questions I'm asking Angela regarding, it's called The Hustle. It's all about business related. We're going to go through very quick answers here, Angela. So first thing that comes to mind, say it. You don't have to go into long explanations. That's not the point of this. So the first question was, what business related book has inspired you the most, or what is your favorite business book?
7 Habits of Highly Effective People.
Very popular book. I think everybody has to read that. Yep, agreed.
For life or business, yeah.
Exactly. Is there anything holding you back, preventing you from moving closer to your future dreams?
I would say that only myself. So I think if I can get out of my own way, then I continue to move forward.
That's a great answer. What important rules have you learned about business that will help make you more successful?
I think that honesty and transparency is huge in business. And I think truly from the bottom of my heart, treating clients and team members how I would want to be treated or expect to be treated is invaluable to everyone that I come into contact with.
Perfect. Do you keep a journal and does it help you?
Absolutely. I think that journaling is super helpful for everyone who does it.
What do you wish you had known when you started out?
Oh, that the course is not always the course. My vision, it's been like this, but it's been a wonderful journey.
That's great. What do you look to, or who do you look to for advice or mentorship?
I have a wonderful friend within the industry who's an accountant who's been a mentor of mine. He owns an accounting company only for dentists. And my dad as well. My dad is an entrepreneur and he's been super helpful at teaching me things in life and in business.
What is the number one tactic you use to stay organized?
Oh, so I have an office administrator assistant. She helps me. And then we also use Keep or Infusionsoft for our CRM.
If you had a chance to start your career all over again, what would you do differently?
Not a thing. Maybe 5 years ago, I would have told you I wish I never did X, Y, and Z, but it's led me to where I am. So I'm thankful for it.
That's really good. Which 3 adjectives describe your strengths?
I think honorable, diligent, and caring.
And last one, how do you distinguish yourself from your competitors?
We are nothing like the competitors. The competitors don't have my team and I. But basically, we are a white glove, very tailored, very personal service. And I find that a lot of the other companies have grown too fast for sometimes their own good, that they have a lot of staff turnover. And we simply, knock on wood, we do not have that because I take the time for the hiring. I make sure that my team is the right people and that they're treated well.
That's really good. I wanted to ask you one more, but so what profession do you think is the most undervalued today?
I think dental assistants are really undervalued. I think that they work their butts off on a daily basis, and they know so much that until COVID hit and the pay increased, it really wasn't aligned with where their value is. But I think their pay and their value is starting to be seen a little more.
Perfect. Okay, so tell people how they can reach out to you, your company, find out more about your services. Give the spiel about Preferred Dental Services.
Sure. So our website is preferreddentalservice.com. Service is singular. My direct email is info@preferreddentalservice.com. And the number that you will find on the website is my cell phone. Call me directly, text me directly. I want to make sure that you're receiving the care that you deserve from the first time you reach out. My cell phone is 302-236-8856. And if I miss your call, I'll always call you back within 24 hours. But I think that's another thing that sets us apart is no one's giving out their cell phone. So I really take pride in that.
And was there an offer you wanted to throw out to the audience?
Absolutely. So we have free setup and installation for all listeners, but for you guys specifically, we are going to do, if you mention Dr. Len's name, then we will do $250 off your first month.
Perfect. This was great. Anything else you want to say before I end the podcast?
No, I'll be at your mastermind in September, and I'm really looking forward to it. And I really look forward to building a long, wonderful working relationship with you as well, Dr. Len. I know we met years ago and COVID hit, so things got crazy, but I think that, now's the time to be in the industry and make those connections.
Well, I appreciate that. And you preempted me there. So thank you. For those that are not aware, I am hosting a summit. It's called Supercharge Your Dental Practice. It is in Delray Beach, Florida. It is September 29th and 30th of 2023. So when this airs, it's about 5 or 6 months later after this episode airs. But it is at the Opal Grand Resort. It's 1 day on marketing your practice and 1 day on the business side of dentistry and running your practice. And Angela is one of the vendors who will be there. So if you have interest, check out superchargeyourdentalpractice.com to learn more about this amazing event that I'm really excited about. Guys, if you like the episode, please share it. Please let your colleagues know. Please tell about Angela's service. They may be beneficial to them. Review us, go onto all the podcast networks and write a review about us. It's really important. And I want to also thank the sponsors, as I always do, Dental Intelligence, the Doc Sites, and Cloud Dentistry for their support. And as I always end these podcasts, remember, your reputation matters. Until the next episode, Angela, thank you so much for joining me today, and we'll talk to everyone soon.